In 2001, archaeologists made a startling discovery on the outskirts of Vilnius, the capital of Lithuania, along the banks of the Neris River. They unearthed a mass grave containing the remains of over 3,000 individuals. What immediately caught the experts' attention was the presence of French currency from 1812 found among the bodies. After careful examination, they determined two crucial facts. First, these remains belonged to French soldiers who had retreated from Moscow to the Neris River under Napoleon's command. Second, and even more shocking, DNA analysis revealed that almost all of these soldiers had been infected with epidemic typhus. In 1812, Napoleon led a grand army of 400,000 troops from continental Europe across the Niemen River, embarking on his quest to conquer Russia. However, this once invincible force met with catastrophic losses in a matter of months. From summer to winter, the army of 400,000 was reduced to a mere 10,000 men. French and Russian armies engaged in battle only once, on the outskirts of Moscow. So what led to the downfall of Napoleon's Grande Armée? The situation unfolded as follows. Russian nobles and military leaders adopted an extremely cruel but effective strategy. They implemented a scorched earth policy along the French army's path of advance, burning, looting, and destroying everything, leaving nothing but desolate ruins in the wake of the advancing French forces. When Napoleon finally reached Moscow, he found a city that had been burning for days. When they arrived in Moscow, the French army had encountered almost no resistance from the Russian forces. However, an invisible enemy had already begun to silently devour this powerful army. In the French camps, a mysterious illness started to ravage the troops. Medical records show that at the peak of the epidemic, up to 6,000 soldiers were falling ill every day. The symptoms of this disease were chilling. Patients would experience high fever and severe headaches, with even the slightest movement of their eyeballs causing excruciating pain, as if their brains were about to explode. Even more terrifying was the fact that these symptoms would recur every 5 days, subjecting the sufferers to endless torment. After falling ill, approximately 40% of the soldiers couldn't survive, silently passing away during the march. This disease not only destroyed the soldiers' bodies, but also severely impacted the morale of the entire army. The culprit behind the spread of typhus turned out to be the lice hiding in the French soldiers' coats. This tiny enemy became Russia's most powerful ally. While Napoleon had anticipated the arrival of winter, he had not foreseen that lice would become his army's fatal weakness. As time flew by, our story fast-forwards to a century later. In 1909, a French doctor named Charles Nicolle arrived in Tunisia to conduct an in-depth investigation of a prison experiencing an outbreak of typhus. Nicolle observed that when new prisoners entered the jail, if they underwent a thorough cleaning procedure, stripping off their clothes, bathing, and shaving their heads and beards, they rarely transmitted typhus to others. However, the cleaning staff responsible for handling these clothes and hair were highly susceptible to contracting the disease. After further research, Nicolle finally identified the true culprit, a species of lice that parasitizes humans. These lice have unique characteristics. They neither jump nor fly, but only crawl, biting when they need to feed on blood, and laying eggs in the seams of clothes when reproducing. Person becomes infected with typhus, the pathogen is carried in their bloodstream. These pathogens infect the lice, and although they eventually cause the lice to die, before death, if the lice crawl onto another person and defecate or bite there, it causes itching. When people scratch and break their skin, the pathogens in the lice feces enter the human body through these tiny wounds, leading to infection. However, despite identifying the transmission vector, a more profound question remained unanswered. What exactly was the pathogen causing typhus? Was it a bacterium or a virus? The pathogen causing typhus was a very special microorganism. They were extremely small, could only parasitize living cells, unable to survive independently, but could self-divide and multiply. In the medical field, they are defined as pathogens that fall between bacteria and viruses. Biologists describe them as bacteria, without a cell nucleus that must parasitize living cells with nuclei to survive. After parasitizing and reproducing in the human body, they attack the lymphatic and nervous systems, causing systemic vascular lesions and neurological disorders. At the same time, they can also cause complications in the respiratory and circulatory systems. Without timely and effective treatment, the mortality rate of rickettsia infection can reach a staggering 60%. Next, we will reveal an amazing true story that occurred during World War II. Let's turn back the clock to 1942 and journey to the small town of Rozwadów in Poland. In this town, overshadowed by the clouds of war, a Polish man covered in rashes was brought to the local hospital. The German military immediately ordered the doctor to examine whether this patient was infected with typhus. The attending physician was named Eugene Lzowski, a Pole who was forced to work for the German army at the time. He told the patient that fortunately, it was just a common allergic reaction that would recover after a few days of rest. However, upon hearing this diagnosis, the patient quietly uttered a heartbreaking statement. "I wish I had typhus. Only then could I avoid being sent back to the labor camp to suffer." These words touched Lzowski's heart, but he didn't react immediately, silently preparing to leave the ward. After leaving the ward, he wrote, "Undiagnosed, needs observation" on the medical record, and then handed it to the German military. The German military breathed a sigh of relief upon seeing the medical record, but immediately seriously requested Lzowski to submit a further diagnosis report within a week. If it was indeed typhus, they would also need a blood sample from the patient for confirmation by the German laboratory. Throughout this process, Lzowski keenly perceived the German military's extreme fear of typhus. On the surface, he continued to treat his compatriots coldly, but internally he was rapidly formulating a tense plan. He decided to develop a fake vaccine that would make blood tests appear positive after injection, but would not actually cause a real typhus infection. His goal was to use this method to deceive the German military, thereby protecting that compatriot and others who might be sent to labor camps. Soon he produced this fake vaccine. To ensure its safety and effectiveness, Lzowski first experimented on himself. After the experiment succeeded, he persuaded that compatriot to accept the injection. Then, he submitted a report of suspected typhus to the German military, along with the patient's blood sample. Shortly after, the German laboratory returned with a confirmation result, determining that this patient was indeed infected with typhus. Based on this diagnosis, the German military not only did not send the patient back to the labor camp, but also released his family. Seeing this family return to the town from the labor camp, Lzowski felt both relieved and nervous. He knew well that if the plan was exposed, a death sentence awaited him. However, this success also gave him hope. He could save more people. A bolder plan formed in Lzowski's mind. Since the risk of saving one person and saving 10,000 people was the same, why not try to save more people? So he began secretly injecting more people with the fake vaccine, then reporting cases to the German military and sending blood samples for testing. The German military was completely deceived by his reports. Seeing the number of infected cases constantly increasing, they quickly designated the town and surrounding villages as quarantine zones. In this way, about 8,000 Poles and Jews, who might have been sent to labor camps or concentration camps, were able to survive. Lzowski's plan seemed perfect, but a crisis soon arrived. Shortly after, the German military received intelligence suggesting that there was actually no outbreak in the area, and the death rate was unusually low. This aroused the suspicion of the German military, and they immediately dispatched a medical team to investigate. When the news spread, all the Poles in the town fell into panic. But Lzowski calmly devised another strategy. He told everyone not to let the German medical team enter the town. Then he proactively welcomed this medical team in a village outside the town. Lzowski warmly entertained the German doctors, drinking and making merry with them. Over drinks, he vividly described the terrible epidemic situation in the town. After several rounds of drinks, the chief German doctor, feeling too tired, decided to let his two young assistants conduct the on-site inspection in the town. Lzowski took these two assistants to a pre-arranged place. This place had been carefully set up to look like a dirty and messy room, with a patient who appeared to be on the brink of death lying inside, and a corpse emitting a foul odor. This horrifying scene terrified the two young German doctors. They hastily drew a few tubes of blood samples and quickly fled from this epidemic area. In this way, Lzowski once again successfully utilized the German military's fear of typhus to protect the residents of the town. This heart-stopping rescue operation continued until the end of World War II. After the war, Lzowski immigrated to the United States in 1958. Many years later, he wrote a memoir titled Private War, and this little-known history finally came to light. In 2000, an American film crew followed the 87-year-old Lzowski back to the Polish town, confirming this incredible story. These stories are not only milestones in scientific history, but also testimonies to human perseverance and progress. They remind us that even in the face of the most severe challenges, as long as we unite and use wisdom and courage, nothing is impossible.